freelance journalist, broadcaster, and with a specialist in social care. So I'm going to hand over to Penny. Please do use the chat at the bottom of your screen and enjoy the session.
Thank you very much, Sheena. It's great to be here. And it's lovely to see so many participants. There's been a lot of registrations for this particular discussion. So I think it shows, just how significant it is. But yeah, my name is Penny Taylor. I'm a journalist. I'm a health and social care specialist, and I've followed the development of the various systems over decades. So I bring to it a long view as well. And I'm passionate about the need for change, which might come across. We've got a hashtag that if you're hearing anything you'd like to share more widely, please use the hashtag OWR for Our World Reimagined, OWR social care. And that will, allow us to sort of spread the word on anything you're hearing. As you know, the meeting's being recorded. So if you're, not meant to be here, if your boss or your other half thinks you're off doing something else, then you just be mindful of that. For everyone else, we really want to hear from you as we go through this discussion. Please use the chat. If you scroll down to the bottom of your screen, I know you'll know this backwards, but just in case, you'll see the chat symbol. Click on that, opens the panel on the right. We're going to, the way we're going to work it is you're going to hear first from Karen Hedge, National Director at Scottish Care. Then we're going to hear from David Alexander, the Chief Executive of Mydex CIC. And then it's into a discussion, and really, we'd really like to involve you and answer your questions. So before we start, I wondered whether I could just throw out a wee challenge to the delegates, the people that are attending this. What's your interest in this field? What do you want to get out of this? I mean, be as brief as you would like or as expansive. Why are you here? It's great there's so much interest. While you're thinking about that and hopefully filing your copy in on that panel on the right, let's hear from Karen Hedge, National Director at Scottish Care, who's going to be talking under the title, Seeing the Diamonds in Social Care Data. Hi, Karen.
Hi, Penny, and hello, everyone else. Thanks very much for having me along today. Yes, I was invited along to talk about diamonds. And really that word is in there because it's talking about what happens when you have that systems under pressure. So from coal, we see the production of diamonds, and actually there's a real potential for the way that we can use data differently in social care. I want to start off with a story because maybe that helps to put this into context where some of the challenges lie. It's not my story, but it's a story of someone very close to me in my family. So here goes. I walk into the doctor's surgery, and the first thing I say is, it was really hard to come here today. My husband's forgetful. Sometimes he's frightened. He sits, he cries often during the day. Sometimes he's angry. It's really hard to be there for him. I don't know what to do. I don't know what he needs. And what do I tell the family? And what happens next is there's a long conversation with the GP who'll say, oh, there's other people that can help you. So why don't you go and have a conversation, maybe with your social worker? But I've already had this really hard, long conversation, raw conversation, talking a bit about my emotions. So then it gets swallowed and it becomes this. Hi, I'm Karen. My husband forgets things and he's really frightened. And then maybe your social worker doesn't have the time to support you with getting that full-on conversation, or you're passed to someone else or whatever, then you have to have that conversation. Maybe it's with an OT the next time, or it could be anyone in the system, let's face it. Hi, my husband needs help. He forgets things. So as you see, the more and more you have that conversation, the more and more of the nuance is lost, the personality is lost, and we lose the real bit about where social care lies, the real meaning of social care, and that's supporting people to meet the definition of the answer to the question, what matters to you? So the fundamental why for doing this piece of research into social care data was that we believe that people should only need to tell their story once. Because when they tell it more than once, the nuance is lost. They can be referred to the wrong person because you're not getting the bits and pieces. And actually, in all of that story, there was very little about the person who is telling the story, and they're an unpaid carer too. So how do they access the right services and the right support too? The other reason that we did this piece of work was to meet that fundamental purpose of social care. So to take some of the nonsense out of the system and start to focus on people and individuals. In Scotland, we have a really, really data-rich social care sector. What that means, though, in practice, is that all those different organisations that might interact with the person or their family all collect data, but they don't communicate with each other about what that data contains. So people have to tell their story to each individual organisation. Individual organisations are experts in different parts of that, but actually, it might be that some of that information is really, really helpful to other parts of the system. And knowing that information would unlock systems, services, people, support that you might not otherwise be able to get. So yes, Scotland is data rich, but it's intelligence poor. That fragmented data collection's really worsened as well, because we all collect our data in different ways. Even looking at different records, our name might be written differently. So I might be Karen Louise Gibson somewhere in my maiden name. I might be Karen Louise Hedge. I might just be Karen Hedge. Sometimes people throw an S on the end of my name and I can be as Karen Hedges. So, you know, within that, there's 5 different ways that my name could be recorded, which means I might have 5 different records, which means that yet again, my story is not being heard by the right people who need it. We also have real duplication and waste in the system because we're having to repeat ourselves over and over again, and we don't have access to things that make sense. So it means that we're all capturing the same thing over and over again. And there's so much potential, you know, if we collected data in the right way and kept our systems in the right way, then actually we can start to think, oh, previous trends, other people that have gone through this experience might experience this. So that means we want to make sure that we've got the right support in before we get to breaking point, before we get to the point that we need a service. We can actually identify what people might need before then. In the bigger scale as well, actually, from local commissioners all the way through to Scottish Government commissioning and policy setting, how do we know what the service of the future requires? That's much easier to determine if we can start to collect what sort of services are needed now and start to track those trends. It helps us to identify what we need for the future. So what did we do? So Scottish Care and a bunch of other people who were a bit frustrated about the way that things were going got together and hosted a series of data forums. We wanted to involve multiple perspectives on this conversation, because actually it's only through working together and collaborating that we can make these changes. So we put out an open invitation, and literally everyone and their granny came along, and just had a really, really good conversation about what those challenges were in the system, what we needed to do to address those challenges. And we developed a vision for data in social care, as well as a set of principles. And we came together as well to sort of co-design those, but also to say, you know, each of us who are involved in this process have a responsibility to take this forward, to go on and make sure that the conversations that we've had, the decisions we've made, the visions we've set, the principles we've set, actually don't just sit on a piece of paper, well, that doesn't get dusty on the shelf now, that sits somewhere on the internet. So how do we take that forward and make things happen? So let's start with the vision. The vision for social care data in Scotland is to start from that human rights perspective. We're talking about enabling people to have control over their own data, how it's shared, and being able to use it to initiate, so to get that care and support on their own terms. So the system is working for them, not the other way around. We aspire to a destination where data is collected, is person-led, not system-satisfying. It's based on needs, wishes, and aspirations of people for their care and support, informs the design of services and planning, and the resulting indicators of performance and success. So we're about halfway through. I'm just going to quickly share my screen so that you can see some of the principles that we came up with, and they might be interesting for conversation. Let's see. Can you see that okay? Brilliant. So here we go. Yep, people should only have to tell their story first. Story once is the main thing that we sort of came around with. We wanted this to be grounded in human rights and ethics as well, to make sure that what we're doing is focusing in on people, because that's what we're fundamentally here for in social care. We have to be working within legal parameters and regulation. We want this to be citizen activated and citizen controlled. So I'm talking about sharing data. I'm talking about sharing it locally. I'm talking about sharing it nationally. But actually, there are bits and pieces there that I might want my GP to know, but maybe there are other people I don't want to know. So I should be able to decide who gets access to what data and what intelligence, so that I know exactly who is able to read and see different bits of what's held on me. We wanted that shared understanding, and that's so that whoever is coming in, whichever part of the system, all knows what the other person is talking about. And that also makes it much easier to collect the data as well, because you're all using the same language, the same words, so it's easier to understand. We wanted measurable intervention that's meaningful. There's no point doing this if it's not going to be for a purpose. You know, we want to make that meaningful change and supporting people in their lives. Otherwise, we're just adding in more burden to the system and onto people. One of the challenges that we spoke about as well was how we were sort of waiting on bits of the system to be up to speed before we made changes in data. So, you know, thinking of the previous data strategy and the creation of, oh my goodness, I'm having a mental blank. The cloud-based system, sorry?
The National Digital Platform.
That's the one, the National Digital Platform. We were waiting in the National Digital Platform to come on board. So we were sort of going, do we do stuff? Do we not do stuff? And then we sort of came to the conclusion that actually there are bits and pieces that we can do without waiting on that. And that actually that may not necessarily be the overall solution anyway. So we came up with the idea that actually we should all just be plowing ahead on the bits of the system that we can make change on anyway. To try and move things forward rather than waiting for that big behemoth to make that change. We were looking at noticing and avoiding risks, because if you're measuring the wrong thing, you can actually cause more problems through unintended consequences. Again, systems should never get in the way. This is about people, you know, having the right data that allows them to have control over themselves. Integration, involvement, and interdisciplinary data. That's about how we can share our data in the right way to affect change and actually stop that duplication in the system. So different people from different sectors can actually come in and support people. And that's sort of similar to the GARFIC model, for those of you who are familiar with that, and which is coming through with the National Care Service. And I'm almost done, Penny, I can see your face. This is the last three. So learning and skills implementation. So this, being able to predict what sort of services we'll need for the future will also help us know what sort of skill set we need for the future. So we can make sure we have the right training available and the right staff and the right workforce and the right composition of services available. We also want to make sure these principles aren't set in stone. The way we interact with data, the systems we have, the technology we have is going to change. So we need to be continually reviewing this and making sure we're up to speed. And above all else, we need to be doing this in a preventative space. This has to be supporting people and supporting this system. So I'm going to stop sharing now and come back to you all. and just say, hopefully that gives you an idea of the sort of things and the principles that we worked on. The big question is what next? And I know David will go on and talk to you about some about that, but I'm really looking forward to the conversation.
Great, thank you.
Thank you so much. That's really great. There's some fantastic contributions coming through on chat. I just wondered if anyone has a copy of your data report. Let's put a link up in the chat, and then people can access it directly, because it is a really good read. It's a powerful read. So let's, before we get into answering some of the issues that have been raised, and they're meaty ones, let's hear on practical examples of person-led data from David Alexander, who's Chief Executive at Mydex CIC. Welcome to you, David.
Thanks very much indeed, Penny. And I think the report is fabulous, and we were very happy to contribute to that as well. I'm just going to share my screen, which have got some images that will sit behind what I'm actually saying. Could I just get a thumbs up that someone can see that? Okay, brilliant, right. So I think what we're going to do is just build on what Karen's been talking about and sharing some of our practical experience working with citizens and those amazing people that are on the front line, whether they're formal carers or informal carers, friends and family. And we've had some important insights and lessons that we've learned during our 14 years of working for and serving citizens, really, as a community interest company. And it really, we do work across all sorts of areas, but there's never been anything more profound than health and social care. So I've got 4 key points that I'd like to cover. We believe, and it's part of our core belief system, is that placing people, citizens, at the centre is fundamental for delivering successful care. We just can't see a route forward without that becoming a reality. Social care is really a web of support, if anyone's ever been involved in it, delivering it, experiencing it. And it's provided by a really diverse range of organisations and individuals. That really means ensuring that the right data is in the right place at the right time for whoever needs it, just as Karen has talked about. And that means joining the dots across those different landscapes and different sources of information. And the concept of the National Care Service won't change that. It becomes essential if a vision for a National Care Service comes into being. And if we don't, I think it means immense stress for all concerned. And it also means you put the outcomes at risk, and we don't want to see that in a modern society. And really the stress comes from a number of different areas. Delays through the many forms of friction, such as form filling, checking information, duplication of effort, repeating yourself time and time again, as Karen has said. And also there's a big risk around errors, the wrong information not in the right place, or the wrong information at the wrong time can lead to significant risk. And there's a huge amount of unnecessary cost and waste. Now, I speak from a lived experience in supporting my father over many years, and my mother during his decline, from diabetes, dementia, Alzheimer's, a very severe stroke, through 5 different settings, and then home, where he was cared for until he passed away. And in that time, I saw his file go from a thin folder on admission to over 40 inches in height, which they almost needed a separate trolley to carry around. It was tragic. And if I wasn't me and I wasn't organised, I wouldn't have been able to make sure he got what he needed. And we call it 4 evils of service, and we call it FERC, or Firking hell. And that FERC is costing billions today annually, and it's draining people's time and effort. And its FERC is friction, effort, risk and cost. It's as simple as that. And we can spend a lot of time talking about COP26 and reducing CO2 if we just got rid of the paper, just got rid of the forms, and got rid of all of the unnecessary manual processes. we could save many billions just there and put money back into frontline. So the short version is we've got to plug these things together. We've got to remove FERC by placing citizens at the centre as that point of integration. And 25 years of failed attempts to do it, organisation to organisation, isn't going to change that. But I wouldn't put it past people to carry on trying to do that and not involving people. So I thought instead of talking more about it, I thought I'd give you a real example of work that we're doing today with Macmillan Cancer Support, Glasgow City Council, West Dun Council, and a number of service providers within those two areas. And Macmillan came to us and said, the world's a crazy place. We run the Improving Cancer journey, and the whole goal is to get the right information to the right people at the right time and get an exceptional support for people living through a tragic experience. And they came up with this diagram that they sent to us, and they said, we think what you're doing could help. We'd like to run a pilot, and we did a discovery project. And that FERC is the picture on the left. That's all of these organizations, everyone trying to do a great job, but no one connected to the individual, and the information flowing backwards and forwards, again and again, but the individual in the middle with no information and no knowledge. So if you're an individual diagnosed with cancer, plus your friends and family, you're entering a whole new world where you can lead to information overload in lots of different formats. You're not sure what's going on. You're not sure where you are. And Macmillan created the concept of a holistic needs assessment, and they wanted to give people a clear pathway through that journey. Now, there's lots of organizations involved. Supporting that person with cancer crosses all boundaries: health, advice, financial support, community support, dog walking service, hot stone massage, nutrition. It's literally an endless list. And within the Greater Glasgow area, there are some 200 and odd service providers that might get involved in helping people who are going on their cancer journey. So it's simply impractical, technically and commercially and legally impossible to link all of those systems together directly. It's just like a plate of spaghetti. It's crazy. So many providers have got limited systems. There are a huge amount of amazing organizations out there that do little more than run things on a mobile phone with an email account. And friends and family, those great supporters, are largely isolated, not able to directly access the information, constantly worrying and trying to find out more information and meeting all of those barriers of data protection and various other things. Even if, like I had a lasting power of attorney, I had to present that over 5 times during a 6-month period to the same organization. It was crazy. So all stakeholders, as Karen has said, have got different information needs. They don't need to see everything. They just need enough to do a great job. In one case for my father, it was simply calling him Joe instead of Dominic, which is his first name, because that's what he'd been known all his life. And the other one was to stop asking him to say what his date of birth was when they were giving him medications, because he couldn't speak after the stroke. And they sat there going, you can't have your medication, Dominic, if you don't tell me your date of birth. And you just sit there going, my God, how is it possible? So privacy and data protection is very important. Now, this is the same story that you'll hear time and time again for many different conditions. It's not just cancer. And many people have more than one condition, as we well know. So getting that right information in the right place at the right time is fundamental. So we've got to eradicate those 4 evils of service delivery. And this really comes down to putting the individual at the center. And what we came up with was this idea, a personal data store, something that sits in the cloud, automatic. We gave friends and family their own view of the person with cancer's journey, which the person with cancer had their own app and they could agree what their friends and family could see. The service providers that didn't have systems could get a view and be able to take referrals and provide support and have secure messaging. And all of the systems could plug in. So we're in the middle of a pilot. demonstrating that this works, proving the theory of change. But some of the heartfelt feedback from people, and I'm thinking about friends and family, one of them turned around and said, do you know what this means? It means I will no longer have to spend my time trying to get my mum to tell me what's going on. I'll be able to see it, and I'll be able to have a conversation about helping her through the next stage of the journey. Knowing what's going on and being an active supporter. The service providers to be able to see their referrals instead of trying to deal with emails and text messages. It's just time saving. It puts people back on the front line of actually caring and having real conversations and making people feel recognized, which is so fundamental. So we're all about that eradication of FERC. We're working on different projects to make that happen. But, you know, you don't have to believe me. Just look at the evidence in the report from that Karen was talking about, or, you know, just go and have a look at the work that the Digital Health and Care Innovation Centre has been doing. We first started working with them back in 2016 on a project called Backpack, which was around multiple sclerosis. But since that time, they've worked on something like 52 co-design projects. They've worked with 41 health and care organisations, many, I think, that are in this room, 3,500 citizens, and something like 1,000 care providers. And they've picked up some really clear evidence of what everybody wants. And Karen said it earlier, tell my story once. Meaningful dialogue with professionals, access and understand data and guidance. It's all there to see. And fundamentally, if you look at this evidence, we've got all the evidence we need for a change in the fundamental way things are working. And there is an economic reality that we're all faced with today. It's not just about the pandemic. Everyone is being asked to do more with the same or less. I don't find any situation where there isn't increased anticipation. So the only way that's possible is if we have a systemic change in approach that cuts out all of the waste, the friction, the effort, risk and cost. And, you know, whether that's informal or formal care that's involved, we can save a huge amount of time. And there's a really interesting project just kicking off now under the idea of healthy aging. It's called Peoplehood. And that's involving a whole load of service providers and communities, 3 communities across Scotland, Cardonnell in Glasgow, Buckie up in Moray, and Charleston in Dundee. And the whole idea again here is to put the individual at the centre, to equip them with the right information at the right time. It's bringing together lots of different local service providers. It's even got cool things like EV car schemes and bikes and everything else, but at the really basic level, it equips the individual with the information about their life. And the goal is healthy aging, independent living for as long as possible. And that program's running over the next 3 years. And we're really motoring now in terms of what that's going to be able to achieve. And then what happens if you take this approach, just as Karen said at the end, is that incremental change becomes possible. You don't have to wait for some giant system that's never going to come. You'll get some really fantastic things like a single source of clinical truth, the clinical data store at the heart of the NHS, but these things have got to work together. And that's the great thing that you see in the digital strategy. So you can, with a personal, putting the individual at the center, you can plug one system in after another. You can solve problems at a local level, which is what we're doing in Glasgow and West Dun and Charleston. The great thing is you end up with proper information governance. You get GDPR compliance because the individual's actively involved. You get informed consent. And these local clusters can work together to solve a specific problem, whether it's food banking, whether it's local care provision for a different group of people. Now, we've rolled that back up into a national initiative that the Scottish Government are running called Connecting Scotland and the Office of the Chief Designer. And what they're looking at is transforming public services and getting citizens actively engaged and getting those citizens that maybe historically have not had a digital experience to be able to become equipped. And we're very proud to be working on that, helping with recruiting citizens using one of our platforms, with all of those citizens having their privacy protected with their personal data store and being able to put anonymous profiles up to take part in the way that change happens. So in conclusion, we have a major opportunity in front of us. These are the slides straight out of the digital health and care strategy. And there's their big picture on the left-hand side, single source of clinical truth at the top. And then you see at the bottom, the single source of personal truth. It's that personal data store. It's there right in the middle. I've pulled it all together to make it a bit easier to follow. And this is exactly the direction of travel that we're now seeing. And it's taken a long while. We've been around 14 years. We've been working with DHI since 2016. I know many people have been contributing to saying there's got to be a better way. Yeah. And we're just excited about what this potential can mean. So my last point is that we can eat, I think we've got a choice in front of us. We can either have a plate of spaghetti on the left-hand side with the people that we're all here to support and serve and help, isolated, not getting the support and services that they need in a timely manner through no fault of anyone on the front line, through no fault of the individuals themselves, because they're just isolated. We can go for a person-centered approach, which is FERC-free. So that's really all I wanted to say.
Thank you very much. And certainly, you know, I'm very conscious while you're talking that, you know, these principles, I don't know whether we can lose that slide off the screen, but these principles, you know, we've been talking about for decades. Yeah. What is it going to take to make it happen? If I can start there before I go to some of the responses, and we've got a lot I want to pack in. So David, what's it going to take?
Well, we've been around 14 years, and for a long while, we used to go and explain to people the potential of this at a top level policy basis. We still do that, but we said the only way we can make this happen is by building what we call proof points. And that meant working with real citizens, real service providers on the ground to build proof points. And that, I think, is the way. This starts at the edge and works its way up.
I'm going to come back to you on that, but I wanted to go to Karen there as well. For you, what's the big block to making this happen in a way that we would all feel it, not in the pockets where, you know, innovation is being made and working?
So actually it's happening slowly, just as David outlined, bits and pieces are happening. But to get it to happen more quickly, we really need buy-in from Scottish Government and real drive and resource to allow that to follow through into the various parts of the sector as well, but also to support individuals across Scotland to have access to digital devices as well to be able to do this. There's a significant amount of digital poverty in Scotland, and we're working our way through it still. Clearly the pandemic's one positive thing to come out of it is it's helped push some of that digital drive, but there's still that digital divide.
Yeah, absolutely. Let me go to a comment here from Susan McKinstry, who's, you know, my question at the beginning was, you know, what do you want to know about here? And Susan's saying, I'm interested in how data and information can be used to improve people's lived experience of social care and how it can be used to empower people's choice and control. Also, and this is the bit of that question I'd like to come to at the moment, how do we mitigate the personal risks in who creates, owns and shares the data? And David, I wondered if I could come back to you on that, because I'm thinking about your peoplehood developments. You know, this risk, the potential risks that seem to freak so many people out and stall any progress. How do we overcome that on the ground in communities, David?
Well, we've found that when you actually engage with people on the front line and the individuals concerned, the risks and the concerns that are often expressed by policy people or IT departments actually are significantly mitigated. Don't forget, the whole idea of this personal data store in our case is that the individual makes choices informed choices. They can do that in the way they would do now. But instead of being isolated with no information, they've got it in front of them. And if they want to choose who they're going to share it with in order to make life easier, as in the case of myself, if my father had been able to say, have this information, it would have made life a lot easier. So the risks, it's GDPR compliance is a core part of this, whether it's informed consent or the other forms of consent, such as in order to provide a service. Data security is an important thing. Nothing should be moving around without that consent. Nothing should be moving around if it's not protected through something called encryption. But putting the individual at the center significantly reduces the risk, because if you think of these giant databases that organizations run that were never really meant to be available on the internet, when you start putting little web front ends on them or portals, you're suddenly exposing an awful lot of information to other people. So I think it's about risk reduction through data minimization. GDPR sets out some very strong principles. And I think the way you do it is you provide proof points. We focus on getting independently certified so that people know that we run a tight ship, that its information security is at the heart. Others may not do that, but we think that's essential.
Yeah, thank you. Karen, in your opinion, do we need a national drive on this to have this conversation with people? To be really pushing this, because it strikes me there's a bit of political cowardice about actually taking this on. Would you agree?
So one of the things that came out of the data forums was actually that everyone involved had a responsibility to push it forward themselves. So we created some tools, backgrounds and things that people could use for social media and start to use those, put their own details in and start to populate that with work their own organization is doing, with the hashtag really that data changes lives. So let's not wait for the juggernaut of the government to do this. Let's take it upon ourselves and start to share positive stories of where we're making that difference.
And do you get the sense that there would be a mood to really start to call for this on the ground? I mean, we heard David's story there. It chimes with one of my own that I'm going through at the moment. Do you think there's a ground root, there's a swell for this?
Sorry, was that me or was it David? Sorry.
I'm going to put that to you, Karen, just now. I'm going to go back to David on something else, but yeah.
Sure, no worries. I mean, I qualified as a social worker over 20 years ago now, and these are conversations we were having then. So I think those of us that have been doing this and having those conversations for that long, and I personally have worked in different seats of different parts of the system as well. So I've seen it from all different perspectives, and obviously through that story of a family member seeing it ourselves, there's just real need to shift. And I think more and more people are feeling that at the moment.
It's a power shift. Before I go back to David, Karen, isn't it? Because actually what we're talking about and what David described there is that professionals in various fields holding on to information that gives them perhaps a bit of clout. Do we have to tackle that?
So as care providers or whoever is holding that data, they have a responsibility to share the information that they store with you. So anyone who is getting a service or supports from anywhere has a right to access that. One of the things that fascinated me once when I was a social worker and we moved offices, we pulled the filing cabinet out and found some very, very old files down the back. I was absolutely astounded at the content and the language and what they contained, and that actually it was acceptable to speak about people in that way. Now, obviously the legislation has changed and now we can, because that information is accessible to anyone, actually the way we write, the way we talk about people has changed as well, because the way that we view people in that human rights, from that human rights perspective, has changed also. But I think there needs to be more understanding out there through the public that they have that right. They are entitled to access it because it is their information. They own it. It's just the organization is holding it for them.
Yeah, David, you wanted to come in there, yeah?
I know it's very good to sort of say governments need to do more. The one thing I would say, working both north and south of the border, is the Scottish government have actually been quite proactive. They have had this Digital Identity Scotland programme, which is seeking to put a personal data store in the hands of every man, woman and child in Scotland. That you've seen the initiatives such as Digital Health and Care Institute. There does seem to be some momentum building, and the Digital Health and Care strategy and the digital strategy do support it. But I do think there are people sitting there frightened and resistant, but I don't think it's the people whose data it is, and I don't think it's the friends and family, and I don't think it's the frontline team. I think it's the IT department. I think it is potentially the policymakers who are quite, in the nicest possible way, I could say it, paternalistic in their sense of trying to protect us all poor people.
How do we change that? How do we change that? Because if that is one of the big blocks, proof it.
Make it real, then they can see it and go, oh, and people actually like this. Yes, look, this is all the feedback we get. Oh, well, that's amazing. And if you're a politician, that means you might get elected.
Let me come back to a question on a slightly different issue, and I'm going to put this to you first, David. Is ownership of data based on the same principles for children, young people, adults, parents, carers? Karen, it was you that mentioned human rights, but I'm going to start with David here.
Ownership is a very complicated subject when you talk about data, because it's not as if you can put it in a bank and nobody else can use it. Data has multiple different uses. We actually wrote a paper on this. Now, I think ownership of data in that sense, control over that data when you are a minor, is the responsibility of your parents or somebody that is legally responsible for you. But as time moves on, you become responsible and accountable for your own data. We make sure that it's possible for people to look after the data relating to their children, and also where they have lasting power of attorney, as we're doing, as you'll see, the modernisation of lasting power of attorney is coming, and they're looking at people being able to hold that data on behalf of other people. But I think ownership's too binary. I think there's rights over certain data, right to use it, right to control it, right to share it, and things like that.
Gosh, okay, so it's a huge challenge, this human rights frame, Karen, yeah?
It is, yes, but what we fundamentally need to come back to is, what is the purpose of care and support? What are we here to do? So keep coming back to the individual, keep coming back to the person. I'll give you an example of where intelligence or data has been used to perhaps make the incorrect decision. So there's a lot of conversation at the moment about delayed discharge, and it used to be that reporting figures went to the ministerial strategy group, just reporting delayed discharge all the time. And when you see the health and social care system through that one piece of data, you don't actually see what are the underlying causes of the issues. So if you bring it in those instances, you're seeing, oh, delayed discharge, therefore we need more beds in hospitals, is what it looks like. But actually you're thinking the whole system. So we need to start and unpick and go down to that preventative bit, come back to the individual, think about their journey from birth to end of life. At what point can we intervene sooner? And data and intelligence can really, really help us that shift, that swivel. Stop seeing it from the system, start seeing through people's eyes.
Okay, great, thank you. And I mean, I'm reflecting on the fact that the Feely report that kind of started all these conversations to a large extent, specifically in Scotland, you know, did very much talk about the lack of data, of useful data that existed across social care specifically, that so little was known about at the time that I think we didn't even, maybe we still don't know exactly how many people are being cared for in care homes. Simple as that, national basis. I would like to ask if Beatrice Vegas is around and on willing to maybe join in this little bit of conversation, because she raised a really important point, saying, having gone from able-bodied to totally dependent, now being chronically ill, I've decided to research and start caring about my care. I'd love to hear from Beatrice, either in person or maybe more in chat, about, you know, what more would you like to be able to do? Does it, you know, does it give you comfort to know that the focus may be shifting onto you as the center of the picture here. You know, do you believe that, for instance? But I'm going to wait for Beatrice to volunteer. I'm not going to make her jump in. Mark Han Johnston has made a comment saying, you know, maybe some children might not want to share certain things with parents. Can there be a confidential space for people? So, oh, Beatrice has said, yes, okay. I wonder whether we can go to Beatrice. Let's see, we've got somebody working very hard on the tech at this end. If you wanted to unmute yourself, you could maybe just start talking.
Okay.
Yay!
Okay.
Great, hello.
Hello. Hi all. I live in Stoke-on-Trent, and when I initially became chronically ill, I was totally confused because I went from one end of the spectrum to the other. And what happened was I felt everybody, including my social carer, did not understand me, ignored me. I said one thing and they put down a totally different thing. And I was so confused. And the fact that they did not explain what I could have or couldn't have. Because don't forget, initially well, it takes a while for PEP to come into place. So you can imagine how I was suffering. And way down the line, I mean, this is a good 8-10 years down the line, I discovered through Eventbrite, I discovered GCVS, and that's why I often come on. Cool. And yes, I've been through most of your sessions. I won't say I understand everything because I'm new to all of this. And I'm not really, I mean, these are all carers and others who have dealt with people with disabilities. So that's what I'm saying. I'm just researching as a layperson. So
well, the perspective you bring to it is absolutely critical and at the center of these discussions. And if we have, you know, we've got to move beyond the rhetoric of that to the reality of that. Now, let me take your perspective back to David Alexander and Karen Hedge and ask David, what do we need to do to meet Beatrice's needs, and how, you know, how could it be done in a way that was meaningful to Beatrice?
Well, first and foremost, Beatrice needs a voice, needs to be heard and listened to. And the way that you do that is by equipping Beatrice, either with support from someone else or directly herself, to be able to express her desires and wishes. And I wish you were in Scotland, where I think there is a greater desire to make that happen. And I don't wish to undermine the NHS or social care in the South. But first and foremost, being able to capture what you wish for, what you want, and what your expectations are, and making it possible for people to see it, listen to it, and subscribe to it, for want of a better term. And that means that the people that are there to support you have a duty of care and a duty of responsibility to listen to you.
Thank you so much, Karen. On top of asking you to respond there to Beatrice, let me just throw in Murdoch Carberry's point made very powerfully in chat. Murdoch is saying, given Karen's point about not waiting for nationally led change, how consumer ready is PDS tech? Somebody's going to explain to me what that means soon. PDS tech for adoption by local citizens and their community of care, brackets formal and informal. So in other words, do we have to, and that's backed up, I think, by Lynn Loughland here, who's saying a simple methodology would be to enable people to create their own digital record and enable them to provide access to other parties. Karen, do we need to turn this on its head now? So
answering the question about that Beatrice asked, first of all, I don't know that I can add much more to what David said. To be honest, you know, nailed that one right on the head there, Beatrice. So,
and remember, this is being recorded and will be available on YouTube for centuries. So you're making a point.
Go back and make it happen. That bit about people being able to contribute to their own personal record, I mean, that's how we would want this to happen, really, where people want to and are able to, and if they're not able to and would like to get support to help them to be able to, because let's face it, that's what the care system's supposed to do, then we should be doing that. We should be enabling that. And actually the backpack system that David had spoke about, the first piece of work they did with DHI did involve that. You know, individual citizens were contributing their own data into that system and then deciding where they wanted it to go. So that's absolutely the route forward.
Oh, but I mean,
and that's what we're doing today in the real world with real people, helping them capture their own views. And the whole goal there, and I think the underlying message is, this should feel effortless for people. It should be obvious and intuitive and easy to use. We put a lot of time into accessibility so that people don't have to key in lots of information, the ability to grab and get hold of data. But, you know, it's not universally available.
Yeah, and it would need to be, I think, to make this work. Let me pick out another couple of points here that are being made. Morag McCarroll saying information gathering at the start of care, questions could be given in advance. This would allow family to discuss best provision, not as it stands when they're read out or explained properly in a 20-minute meeting. You know, there's some really great perspectives on the benefits that this could bring. I'm scrolling through here. Yeah, this could all be in the person's first language as well, using digital technologies, you know, basic communication solutions here. And Susan McKinstry saying something as simple as making sure that a person's communication needs and preferences are recorded and adhered to can make a drastic difference. Astounding how often it doesn't happen at the moment. I mean, I heard very much from Beatrice there, you know, a real plea to do this. And to do it now. We're in our last kind of few minutes of this session. Karen, I want to come back to how could we as consumers help to influence this now? How could we, you know, me as a carer for a friend in her 80s who has been experiencing terrible problems related to this, as David described, kind of like, what can we do?
For it. Ask for it. You know, keep pushing, keep asking for it as part of the care and support that you receive or you access. It is a service to you. You know, you are effectively a customer, so ask for it. One of the challenges we have, obviously, though, is that people come to the system, they come to the sector often at a point of crisis. Yeah. So they might not be in a position where they can ask. So if you're a professional here, then takeaway from today is for you to go away and raise this and push for this. But it's really getting that message out there is what's really important.
Yeah, thank you. And David, from your perspective, you know, what more do we need to do? What can be done? I suppose my frustration is I could be sitting here in another 20 years when it's going to matter a great deal more to me than it even does now. And we might not have moved on. I would be very disappointed.
There's not going to be a big bang. You've got to literally, we spend our time working on individual projects in individual areas. Charleston, Cardonal, Bucky, let's get that right for 3,000 people. Let's build that as a proof point. That's the high profile. There is an awful lot of interest in how we can transform the service, but without proof, you've got a sea of people who've grown up in an organization-centric way.
I know, but how much proof do we need? Is there not globally enough proof? I mean, Estonia's just done it. Why can't we?
But no, they didn't do it. That's the whole point. They built a giant database that they run as a nation state. If you leave Estonia, you've got nothing. Let's not use Estonia as the example.
I hadn't thought any wider than Scotland, to be frank.
You know, so. Scotland is moving in the right direction. The more proof points, you're seeing local authorities on board, Glasgow on board, West Dun. You're seeing the Scottish government moving that way.
Housing's got to be critical in here.
Yeah, well, look at Blackwood,
etc.
Yeah, Albert House. There are lots of housing associations can see that they have a wonderful role to play in helping their tenants get stuff done, and it is the practical proof that is needed.
And they could be a bit of a linchpin to help
an anchor. Absolutely,
yeah, absolutely. Sorry, Sheena, Arthur, I wondered if I could draw you back into this conversation. You know, what linking this discussion to the future of social care and the formation of the National Care Service post Feely, what do you think are the big takeaway messages here?
Thanks, Penny. I share your concern that we're going to be here older and greyer and having the same issues. But I think through all of these conversations relating to the National Care Service, it's about people being, and I think Karen's saying at the start, you know, being person-led, not system satisfying. If we keep feeding this system, we're just going to get more and more of the same, more complicated. But if we can change the perspective to be about the person, why are we here, what are we doing, and that shouldn't be too big an ask. And I think I'm increasingly thinking, you know, we don't wait to be told to do this or given permission or somebody to write a strategy. There's all these great bits of work, and I love David's notion of, you know, doing small things, showing it works, and kind of creating a wave, if you like.
Yeah, and it's, you know, once you connect one system, whether it's a case management system, once you've done it once, it's done. And therefore, whereas every time you end up, I mean, I've sat in rooms and listened to software vendors all arguing about the complexity because they all want to be Lord of the Rings, you know, one ring to rule them all. And, you know, I'm saying, well, it's not as complicated as that. You only need to make your data portable, let the individual plug in, then somebody else downstream who needs it plugs in and gets it. And they can stop this. It's commercial protectionism to some extent, I think.
Yeah.
You know, it's a complicated area.
Have we moved beyond that? Because, you know, there are a lot of theories about how we can do that. Is there a commitment to move beyond that?
It really, Penny, that depends on which sector you're in. If you look at health in Scotland, they've said we're going to use HL7 fire. Then somebody else says we're going to use something called open air, you know. And at the end of the day, it's techie language, but we should be working on one thing. Portable data.
Yeah. Okay. Thank you very much. And Karen, are you optimistic? You know, where are you on a spectrum of optimism about whether we can actually make the visions that we discuss so passionately and make so much sense to so many of us? Are you optimistic we'll ever?
So I think we need a two-pronged approach. So with this groundswell, I think there's also an opportunity with the National Care Service coming forward in that we might have that push, a national space to move on and get going and get some of this done. The key thing that needs to happen though to free this up is to start removing some of the bureaucracy that exists in the system. So actually this would be a really good way to simplify things. There are lots of examples where too much data is collected actually, and actually we just don't need some of that. We just need to go back to really simple. What matters to you? Who do you need in your life? And who, of those people, what do they need to know? Just come back to those really, really simple things. Don't talk about the layers and all the background stuff. Just talk about it in a way that people need it to work.
And why is that so hard to do, to get the message through?
Oh, Penny, you're driving me hard today. Yes, well, power imbalance comes into that, complications, fear, you know, there's a lot of history that we're unpicking to make this change. A lot of organizations that have existed since time began really have been gathering this data. So as we have been doing this, you know, I said I learned some of this stuff when I was studying social work over 20 years ago. Hopefully, as we move through the system, there'll be more and more of us coming up into those layers where we can make that change, who have lived and breathed this thinking.
This is such a rich discussion area. We could talk about it for several more hours. However, we have almost hit 3 o'clock. Before I thank absolutely wonderful speakers in Karen Hedge and David Alexander, and of course Sheena Arthur, I'd really like to thank all the people that contributed comments and questions. And a big thumbs up to Beatrice down in, what was it, Stoke-on-Trent. Thank you so much, really fantastic contribution. Before I say bye-bye to everybody, let me just highlight the next session in the OWR, the Our World Reimagined series. It's a focus on international lessons about co-production, which is a nice segue to this one. It's happening during co-production week on the 25th of November at 1:30 p.m. And thank you so much, and very good luck, all you folk that can make this happen.
Pleasure. Thank you. Lovely to be here. Take care.
Thanks, everyone. Good discussion. Thank you.
Bye.
Thanks very much.